I think the hardest part about being in recovery is losing people, and we do a lot. Every week, we lose people. It's an epidemic, and we're at the front lines, and we see it every day. People relapsing, people going back to jail, people dying, talking to mothers and sisters and brothers who get to bury their loved ones.
We moved here, and the first thing I thought was, Zach's never seen this house. And I go outside, and I think Zach's never been on that diving board. And we buy a new car, and I think Zach's never been in this car. The piece of my heart will always be missing. That doesn't ever get better.
I came back from college, and I was able to obtain OxyContin on a daily basis. There was a point in time where I remember I lost the power of choice. 11 days out of prison, my mom had found me dead. And my brother was in town getting married. And so my mother almost had to bury son and marry son in the same day. And that didn't keep me sober. Just the fact that I see people dying all around me does not keep me sober.
It was the last day of 8th grade, and it's just like a normal day. You know, I just got my pills and get high on them. And then I don't really remember much after that. I kind of just woke up the next day in the hospital with my family there, and they said I was very lucky to still be alive. The amount of pills I took should have killed me, but I got lucky.
I've seen a lot of death in my former life. I've seen a lot of death. You know, I've seen people OD into bathtubs, sitting on the edge of the bathtub and hit themselves with a rig and just flatline into the bathtub. You know, so it's ugly. It's the truth.
We're killing more people by prescription drugs, and a large percentage of them prescription drugs are opioids, you know, that are prescribed by doctors. And we've also seen, and some studies have shown, that a large percentage of people that get addicted to these opioids, you know, prescription-type opioids, often resort to heroin. Opioid and prescription drug-type related deaths have increased every year for the last 5 years. So it's a growing problem. It's something that needs to be addressed, and it's getting worse every year.
If we look at calendar year 2015, this office saw a total of 379 overdose deaths. Of those deaths, the primary drugs that were involved were heroin and morphine and oxycodone. I mean, they're so prevalent that we see overdoses almost every day. Opiate medications are dangerous, so you know, people don't necessarily view them that way. It's like motor vehicles, or overdose deaths are more common than motor vehicle accident deaths. And so you get a prescription from a physician for an opiate for some kind of procedure or nagging pain, and just knowing that pill may be more dangerous than driving your motor vehicle, especially if you're taking it in combination with other drugs.
This is an epidemic that isn't hidden. It's not somewhere far, far away. It's right in our own backyards, our own neighborhoods, our own schools, and it's something we're either going to address as leaders, parents, and policymakers, or we're going to see more kids die and more avoidable deaths in terms of our brothers and sisters and extended families.
Here is a picture of Zach with his two sisters, and of course, this picture, he was in middle school, and I think this is the start of his experimenting with marijuana, and then of course, it never just stopped at marijuana. He suffered a significant stroke because he had an infection in his heart from using needles. We lost him in June, and I can recall them trying to get his heart to start again. And then I just remember sitting on the floor in the corner, listening to them and listening to him die.
The death certificate listing acute mixed drug as the cause of death.
The night my mom died, she had, as far as I know, she had taken just a couple or a few 15 milligram oxycodones. I believe she mixed it with some Valium or diazepam, and she chewed a fentanyl patch.
Heroin and opiate deaths are up across the United States, including here, and the total numbers are up. Those drugs are prevalent and they're common and they're inexpensive. So they've been, prescribed more, over the last maybe 20 years than they have prior to that time.
Pills are everywhere. Every medicine cabinet in the United States has pills. Every doctor prescribes pills because that's the mode, that's the means. So if I get injured, I'm coming into you, I'm coming as a doctor saying, hey, I'm injured, I need pills.
We are prescribing a lot more opiates than we ever used to before. Opiates were thought to be fairly safe, so a lot of different practitioners were prescribing opiates for various pain. So as that trend continued on and on, we're seeing more and more patients that had developed addiction to opiates.
What was our dose last time?
I was an active gymnast my whole life. And after a surgery that I had on my knee, I began taking OxyContin post-op, prescribed to me. And right away what I experienced was a sense of relief, like I was somehow gonna be okay. I never thought that I would be a drug addict, and I never wanted that for myself. I wasn't proud, but I didn't think I had a choice.
Before 2007, I had a wonderful life. I was a welder. I had been at my job approximately 9 years by then. My kids were doing good. We were buying our own house.
I was starting a paramedic degree was what I wanted to do. I went to school for. I stopped to get my education in and my experience in as an EMT. And I ended up just deciding that I was gonna stay at home with my kids, be a housewife. I was taking about 3 15 milligram oxycodones. Every day I woke up, I was sick. So before you even get out of bed, you're looking for your pill bottle. It's a vicious cycle.
It started after an accident, my motorcycle accident in 2007. And after all the surgeries and everything like that, I was actually prescribed pain meds for years. My mother-in-law had told us about her doctor. So that's why we went to him, because we knew we could get what we wanted.
Vast majority of doctors in Arizona are doing the right thing. It's those unscrupulous doctors that are cutting corners, putting profits before patients that are harming our Arizona communities through these opioid drugs.
Thank you, sir. Gotcha.
So starting with Sage, what was your deal with him?
He gave me a lot of pills and whatever I wanted. And then he told me what I could get for him. That's where it started. I had him. And he had me because he just gave me these pills. And I was hooked. I started using heroin. And
Dr. Edward Sage was sentenced September 11, 2015 to 4 years in the Department of Corrections. What resulted in that case was a 277 count indictment against Dr. Sage and approximately 10 other individuals that were involved in a massive billing fraud and massive prescription drug ring.
I made a list of what I wanted. And I went and I gave it to him. And he didn't examine me or nothing. He just took me in his office.
These are incredibly, incredibly powerful drugs. And we've given doctors the ability to prescribe these in this country. And the ones that go rogue wreak havoc on the country. Don't get me wrong, these drugs have very legitimate needs in our society. I think the problem is that if you're consuming 99% of the world's hydrocodone and 78% of the world oxycodone, I think that's an overprescribing problem. I think that's an overuse problem. So right now we're going to our drug storage warehouse facility where we hold all these drugs before they get disposed of. So you'll see an idea of the volume of prescription drugs that we have in this country. There are literally billions of these pills on the market. 280 million prescriptions a year roughly are written in the United States. And that's a prescription. That could be 5, 10, 15, 20, 50 tablets. So you're talking about billions of these pills out there. Each and every single one of us caused the problem. We provided the demand for these prescription drugs. Doctors, pharmaceutical companies, the government, everybody else met the demand that the citizens of the United States wanted. We demanded these things. And now, after all this time, we're facing this huge epidemic. Here, we have a bottle of hydrocodone. And this is what the hydro pills look like. So 99% of all of it manufactured in the world is this product right here, and it's consumed by American citizens.
What it looked like for me was overdosing in the college dorm room and being asked to leave Colorado State. I don't want that to be my story at ASU.
I knew once I took Oxy, I was okay. And it didn't feel wrong because it was prescribed to me and it was for a legitimate reason. Taking Oxycontin at 14 quickly led to every other opiate. Being sober and staying sober wouldn't be such an amazing celebration if we didn't realize that the other alternative is death.
The life of addiction, you lose everything. I went from being a pretty good student, pretty good person to, doing what I had to do to get my pills, whatever that may be, selling drugs, stealing from people, robbing people, whatever it was, I would do it. I never thought I'd see a day sober, let alone a year. This last relapse, I thought it was it. I was either gonna go back to prison for the rest of my life or I was gonna die. I started having medical problems. I had a knee operated on and I got, naturally prescribed. And then from there, I started buying them on the street, anywhere I could get them. I lost everything. I lost myself. I missed my first daughter's first words. I missed her crawling. I missed her walking. I missed everything. If I hadn't started with pills and I hadn't experienced that euphoria for the first time, I don't think I would have progressed as quickly as I did to harder stuff.
Right here at this light that we're coming up to it's probably one of the biggest places for pills, heroin. I worked for the Mesa Police Department for 7 years. I was working narcotics and I was run over on duty. At that point in time, I was prescribed medication, opiates, and they were prescribing me 2-3 months at a time. And then so in the meantime, I could go from one doctor to the next, and I had 6 months of pills. I kind of came to a day where I was out of medication, and I was probably out of medication 5-6 hours, and I thought I was gonna die.
It would fight me harder, so I finally surrendered to it, and it took me over.
Okay, good. So I understand why people don't want to get clean, but the reason we're in those addictions is because we see nothing else.
They're always chasing the first high that they ever got, because the first high is the best high they're ever gonna have. So they're always trying to find a more powerful drug, the ability to take more of that drug. They're always trying to get that first high, and they're never gonna reach it.
Once you've tried your drug of choice, you try and catch the same high you got the first time, but you never do. So I took 26 Percocets in 2 hours. So I OD'd, but I didn't actually go to the hospital over it, which was kind of weird, but I never really sought medical attention because I didn't want to get red flagged and not be able to get the pills, to be honest. It's not a fun feeling to know that you're gonna die over a drug, something that you could have prevented.
Before I turned 13, or once I turned 13, I started taking like Percocets and Xanax, and then that took off right away. And then eventually just all that turned into heroin use and meth use once I was just about 14. It took away my whole teenage life because eventually it got to a point where I was getting locked up in juvie over and over again. And like, I would go in and I'd get out and I'd be doing the same thing. You know, I'd go right back in.
I was actually a horse wrangler at Ponderosa Stables, which is in South Phoenix. And, you know, I'd had a back spasm, and I was bending over to pick something up after, like, the day before I'd unloaded, like, 10 bales of hay by myself. And when I went to see my doctor, they did the MRI and all this stuff, and it turns out that 2 of my vertebrae are bulging. And she, right off the bat, wrote me a prescription for 180 Percocets and 180 Somas just for 1 month. You know, you get handed 2 scripts for 90 Percocets a piece. It's really, I don't know, it's kind of hard not to get hooked on them.
A less severe type are
People receive a prescription of opioids from their doctor for oftentimes an acute condition. And they realize that it treats their pain, but it also makes them feel very good. As you use opioids, your body gets used to it, so then they need more of that drug.
I had to take more and more of the medications, and then I lost my insurance. So I began having to buy stuff for people off the streets, and I just didn't think I could get through a day without my pills. People need to be careful about what they're taking, and a lot of people that I know that are in these programs that I am in thought it was okay, it was prescribed by a doctor. You know, just like me, I was prescribed by a doctor, it must be fine. The pill bottle says 1 to 2 every 4 to 6 hours, okay? So I'm gonna take 2 every 4. I'm gonna push those limits because I like the way that it makes me feel. It doesn't just take away the pain, it makes just your whole life seem like it's amazing.
Unfortunately, in the past few years, we have had an increase in opioid overdoses, and has been obvious. And we've noticed that in the emergency department, that there's a lot more patients that we're treating. It is no longer an inner city versus suburban problem. It's everybody's problem. I've worked in multiple different emergency departments, from inner city to suburban to rural, and everyone has this problem. It does not discriminate against gender, age, income. This has hit everyone.
My daughter, her name is Chloe. She is just the happiest, smartest, you know, kid that I've ever seen. When I had gotten pregnant with her, I was actually, you know, still using. And luckily, it didn't affect her.
Neonatal abstinence syndrome is something we see in infants who have been exposed to mothers taking narcotics. I think what a lot of people sometimes don't realize is everything you do to yourself, you're doing to your infant as well, whether that be drugs, whether that be your nutrition, you know, all those things affect what you're doing for your infant.
6 months ago, I was incarcerated. So I ended up having my baby here at the hospital while I was incarcerated. And I was put on methadone when I went into the Estrella jail. And they put me on methadone at 3 months pregnant. If I would have known that years and years later I would have had, you know, this happen. And I'm so lucky to have him, but I'm not happy about him paying for my mistakes. Do whatever you have to do to get clean, but make sure it's out of the safety for you and your baby, but do whatever you have to do to get clean, because you don't want to have to see your baby go through that.
There's huge pressure from pharmaceutical companies and patients for doctors to write these prescriptions. We demand that they give us these pills. And so these doctors are going to succumb to that pressure. Doctors are businessmen. They have to make a living doing this. And so they don't want to lose customers.
When that opiate hits you, your depression's gone, all your pain's gone. There's no difference in what I was doing than the people on the street do with their heroin every day. It's just, they go to somebody on the street corner with dope, and I was going to my doctor, and he was writing me the prescriptions.
I've never met Dr. Osborne personally myself. My mother went through him for about a year before she died. He knew she was using other drugs, street drugs. He was warning her, telling her that he wouldn't give her any medication next time if she tested positive again. But, I mean, he would still increase it. He just kept giving it to her.
There's a need for prescription medication, and we get that. The problem is where does that end? Where does that need change to a want?
I remember I had shoulder surgery, and I remember convincing the doctor to give me more, and then going in about a month later, and him just writing a prescription liberally for the next 3 months. And I wasn't in pain anymore, but the excitement that I got that the doctor was giving me refills on my pain medication meant that all summer long I was gonna be able to abuse these.
If you have one doctor who goes sideways and he's writing 30 or 40 opiate-based prescriptions per day for people, he's doing tremendous damage.
Dr. Albert Ye, who practiced medicine in Nevada, would come to Arizona, specifically in Mojave County, for 1 day a week. During that 1 day a week period of time, 7-hour span, he would see hundreds of patients. And it quickly became apparent that what was going on was massive prescriptions being written and put into our Arizona community.
I mean, these are our kids. These are our neighbors. There are consequences for this, and it is heartbreaking when you meet the families and the parents or attend the funerals.
I started a group called GRASP, and the purpose of GRASP is for parents who have lost their children to addiction. I remember after he passed away, my oldest daughter saying, not only did I lose my brother, I lost part of my parents because you'll never be the same again. And so my daughters were immensely affected by losing their brother. That's their only brother.
I've been to 11 rehabs. I've been to prison twice. I have lost countless amount of friends. I've lost my integrity. I've lost my self-worth. Most of all, I've lost a relationship with my family at some point where they stopped trusting me.
These are some of the pictures from 2001, Brett's senior year in high school. We had just become aware that there was a drug problem. The day before our oldest son got married, Brett was the best man in the wedding. And Brett had overdosed that day, and Janice had to call 911, and people came out and resuscitated him. We just had like the best and the worst of days ever.
This is the photo that was taken at my oldest son's rehearsal the day before his wedding, and it was the day after Brett had overdosed. This is a disease. This is a horrific disease that needs to be treated, can be treated. Recovery does happen. And so I want there to be some hope. And I think in the long run, if you're able to survive it, you come out a stronger, more compassionate person.
I think as a parent, you can always love your child, no matter what the situation is. And then to find the best help and professionals and experts in places where they can make the right decisions, where they can get the assistance they need.
If an individual is willing to come here, they're at rock bottom because they have to give up 6 months of their life. They don't just get to continue with their jobs. They have to make a commitment. My goal is to replace their addiction with something bigger and better. They have to come in and say, I have an issue, I have a problem, I have to admit what I'm doing wrong, I have to submit. And that's what I'm seeing. I'm seeing a lot of hope.
Dave Baker, Rex Chapman back here with you on the Texas Roadhouse Countdown, a tip-off show.
Their athletes just aren't as big as our athletes. Not as good basketball players as our guys.
I was 32, but my body I started getting hurt right away in the NBA. Missed, I don't know, 200 or 300 games over my 12-year career. I was given painkillers, you're given them after every surgery you have. I'd never taken them, ever, until my last surgery. I had an emergency appendectomy, and never played anymore after that. I was going to retire, 10 more games. The season was going to be over. And this doctor put me on OxyContin for an appendix surgery. I took the medicine, and I can pretty much say from the first time I took my first OxyContin, I was in love with it.
The first step, I think, is to educate medical practitioners like me and my colleagues to not prescribe opiates just for everything. We have to change our whole expectation, whether it's from the patient side to the practitioner side, that maybe you don't need opiates for every pain that you would have, and that's going to fix everything.
I think as a society, we need to make some changes. I mean, we need to make some very strong changes as far as prevention, education, and treatment. I mean, we can arrest these people all day long and put them in jail. That's not going to fix their problem.
It's going into suburban America. It's hitting kids younger and younger and younger. It's not getting the attention that it deserves, and it's not getting the attention that it so desperately needs to save lives.
To the doctors that are abusing these products or are part of these drug dealers that are trying to use the law or regulation to run cover for them, not only are we going to fix that, but we're going to find you as well.
We have to change the way that we demand medical care in this country. We have to change the fact that we want a pill for everything. And until we do that as a society, this problem's not going to change.
I wish I would have known more about prescription drugs. You have to learn how to live differently. And every single day, I have to learn how to live differently. Zach, he is everybody's son, everybody's grandson, everybody's nephew. If he were here, he'd tell me, Madre, it's okay, I got this. That's what he would always tell me. But he didn't, he doesn't. So I got this for him.